Unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and to insert extraneous material on S. 610.
Without objection.
Thank you, Madam Speaker. I yield myself such time as I may consume.
The gentleman is recognized.
I rise in support of S. 610, the Protecting Medicare and American Farmers from Sequester Cuts, which will, among other things, extend additional relief to Medicare providers in 2022 to support providers during the COVID-19 public health emergency. In 2019, the Centers for Medicare and Medicaid Services made changes to how different physician services were valued relative to one another in the Medicare payment system. While physicians performing many primary care services saw an increase in payments as a result of these changes, other providers saw fairly substantial reductions, which were not phased in. That is why last year, Congress provided a 3.75% increase in the Medicare conversion factor as a transition to the providers that were most affected. This legislation continues that glide path, with a 3% one-year increase in the Medicare conversion factor, providing a bump in payments. With a new COVID variant emerging here in the United States, this will be important support for our frontline workers. This legislation also eliminates the Medicare sequester, the 2% cut slated to take effect in January, and instead provides a glide path by fully eliminating the cut in the first quarter and phasing it down to 1% in the second quarter. Lastly, the legislation imposes a 1-year delay on clinical laboratory reductions and a radiation oncology payment model to provide additional time to adjust to these policies. These common sense provisions were also included in the legislation that I'm proud to have introduced earlier today, along with my colleague, Congresswoman Schreier. These provisions have strong support from the medical community, physicians, and hospitals because those in the healthcare field recognize that we must ensure providers have the support that they need to care for patients as we continue to battle the COVID-19 pandemic. A letter from 20 surgical groups notes, and I quote, "We urge Congress to pass the Protecting Medicare and American Farmers from Sequester Cuts Act to mitigate the 2022 Medicare payment cuts." This legislation will also provide a procedure for the Senate to raise the debt ceiling. This deal was struck by Senate Republican leader McConnell. As much as my colleagues across the aisle may claim, this is not about new spending. Increasing the debt ceiling will prevent us from defaulting on debt we already owe. It's about investments that Congress previously approved. In fact, 97% of the current debt was accumulated before President Biden assumed office. This vote is about protecting the full faith and credit of the United States of America. A default would spell disaster. Nearly 50 million seniors could stop receiving Social Security checks for a period of time. Troops could go unpaid. Millions of families who rely on their monthly child tax credit, a tax cut, could see delays. Our current economic recovery could reverse into recession with billions of dollars of growth and millions of jobs lost. According to an analysis by Moody's Analytics chief economist Mark Zandi, the recession could wipe out as many as 6 million jobs and erase $15 trillion in household wealth. So I'm proud to stand in strong support of this bipartisan agreement that will end the specter of default looming over the American economy and the American people. I urge my colleagues to support this responsible measure, and I reserve the balance of my time.
Gentleman reserves. Gentleman from Texas is recognized.